Depressive disorders are very common psychiatric mood disorders. They are mainly characterized by profound sadness and slowing of movements and thoughts. These symptoms can be highly disabling and significantly impact the daily life of the affected person. The diagnosis of depressive disorders relies solely on the analysis of the patient's symptoms, without the need for biological tests or imaging. This is why a thorough medical interview is essential. The treatment of depressive disorders primarily aims to reduce suffering and functional impairment, allowing the person to regain a normal quality of life. It also seeks to decrease suicidal risk, shorten the duration of the depressive episode, and prevent progression to chronic depression, which is more difficult to treat. Before initiating treatment, it is essential to assess the severity of the depressive disorder. Tools such as the Hamilton Depression Rating Scale are used to measure symptom intensity across multiple domains. It is also important to evaluate suicidal risk and the patient's overall condition. In certain situations, hospitalization may be necessary. When depression is severe or accompanied by melancholia, a serious form characterized by total loss of pleasure, intense guilt, and sometimes delusional ideas. When suicidal risk is high, to ensure patient safety. When the person is unable to care for themselves, hospitalization may be decided either at the request of a third party, family or close ones, or involuntarily in cases of immediate danger. Medication-based treatment mainly relies on the use of antidepressants, which may be combined with other drugs depending on the patient's needs. The choice of antidepressant depends on several factors, including the severity of symptoms and tolerance to side effects. Selective serotonin reuptake inhibitors (SSRIs) are commonly used. Examples include fluoxetine, paroxetine, and sertraline. These are typically prescribed as one capsule per day and have fewer side effects than older treatments. Tricyclic antidepressants such as amitriptyline and clomipramine are also used but generally have more side effects. It is important to note that antidepressants must be taken for a minimum duration of 6 to 12 months to ensure effectiveness and prevent relapse. Their effects usually appear after about 15 days. In some cases, additional medications are needed alongside antidepressants to manage specific symptoms. In the cases of anxiety, anxiolytics like alprazolam are often prescribed at 1 to 2 milligrams per day. If agitation and sleep disturbances are associated, a sedative neuroleptic such as levomepromazine can be added, often with a vegetative corrector to reduce side effects. For persistent insomnia, a hypnotic like zolpidem can be taken at 1 to 2 tablets at bedtime. One of the most critical aspects to monitor is suicidal risk. This risk is particularly high when the patient starts to feel better, smiles again, and regains energy. This phenomenon, called the tail of melancholia, occurs because the patient now has enough energy to act on persistent suicidal thoughts. Side effects of antidepressants must also be considered. For example, dry mouth is common and can be alleviated by chewing gum or taking a medication such as cantabilene. Another important aspect is manic switch, a complication where depression evolves into a state of excessive excitement and impulsive behavior. In this case, the antidepressant must be discontinued immediately, and a neuroleptic combined with a mood stabilizer like tegretol should be introduced. In certain severe forms of depression, a treatment with therapeutic electroconvulsions (ECT) may be considered. This technique, performed by a psychiatrist in a specialized setting, is indicated in several situations. In cases of stupors or delusional melancholia, that is, when the person is in a state of extreme inertia or presents delusional ideas. As a third-line treatment, when depression is severe and resistant to usual medication treatments. When antidepressants are contraindicated, for example in a woman in the first trimester of pregnancy, since ECT has no harmful effect on the fetus. ECT is one of the most effective treatments, with a success rate of up to 90%. Beyond medication, psychological support is always recommended. Cognitive behavioral therapy, or CBT, helps to modify negative thoughts and maladaptive behaviors. Psychological support allows the person to feel listened to and accompanied throughout their treatment journey. In addition, socio-therapeutic interventions can help improve the patient's daily life by promoting social integration and general well-being. Thanks for watching until the end, and don't forget to like and subscribe for more videos.